Good morning. Is it on now? Good morning and welcome to the first meeting of the Senate Finance and Appropriations Public Safety Subcommittee of this session. Let's start this morning by having the senators present introduce themselves and the areas they represent. I'm going to start with Senator Pillion on my left.
Todd Pillion, the new 6th Senate District, Lee Scott, Laws, Washington, Russell, Pickens, Buchanan, cities.
And I'm Adam Eben, chair of the subcommittee representing the city of Alexandria and portions of Arlington County and a bit of Fairfax County as well in the Bailey's Crossroads area.
I'm Senator Dave Marston from Fairfax County. We have mostly the Annandale, Fairfax, Springfield area, kind of central north parts of the county, and former director of the Department of Juvenile Justice.
Good morning, Ghazala Hashmi, representing the 15th District, which is parts of City of Richmond and Chesterfield.
Thank you, Senator Hashmi. Before we hear our first presentation, I just want to point out that we've got less than 5 weeks this session until we have to report out the Senate budget. And I think, as most folks in the room know, over the past biennium, the General Assembly has provided significant investments in public safety, including raising the salaries of our public safety officers, increasing funding for local police departments, and providing violence reduction grants to communities. This year, the governor has proposed a net increase of approximately $2 million for the public safety and homeland security agencies, which includes more than $100 million in proposed savings from correctional facility closures. Our first presentation this morning is going to be from Secretary Terrence Cole. The Secretary of Public Safety and Homeland Security will provide a briefing on current public safety issues, from human trafficking to officer wellness, and an overview of the proposed items in the governor's budget. We're then going to hear from Judge Dotson, Director of the Department of Corrections, who will walk us through the department's decision to close 4 facilities to assume state management of Lawrenceville Correctional Center from a private operator. I look forward to hearing the department's plans for ensuring a smooth transition from Lawrenceville, especially amidst some staffing challenges and shortages statewide. Finally, our staff, Katie and our appropriations staff, will provide an overview of items in the introduced budget that are being considered by this subcommittee. But we'll start with Secretary Cole, and thank you for being here today, Secretary, and you can begin your presentation, please.
Opportunity. Just like to review some of the priorities for public safety and homeland security moving forward. The first priority is addressing compensation, recruitment, and retention. The second, supporting officer and first responder wellness. Third, enhancing safety and security at DOC. The fourth, reducing violent crime to include gangs, human trafficking, drugs, and hate crime. Prioritizing the systems of our infrastructure enhancement, meaning IT security. And lastly, strengthening our homeland security and cybersecurity. The governor's introduced budget increases for each one of these priorities. Officer, first responder wellness and recruitment at DCGS, our career progression at DOC, which Judge Dotson will be able to elaborate on, the transition of Lawrenceville, the increased DOC operational funding for religious meals and utilities, the purchase of body scanners at DOC, the funding addition for the VSP staff at the Fusion Center, our campus safety coordinator at VSP, the increased salaries for sworn personnel at VSP, the increased grant funding to combat hate crime at DCJS, the increased funding for victims witness grant funding at DCJS as well, and total funding for Operation Ceasefire, gun violence prevention programs, and parts of Bold Blue Line, along with improving our agency's IT infrastructure.
Before you move on,
Yes, sir.
do you want questions at the end, or can we ask questions as we go, which is your preference?
Whatever's
Well,
convenient,
let me ask a question on slide 3 regarding the detail on the recruitment. I was wondering if you could give us a little bit of detail. I think it was up to $18 million. Besides sign-on bonuses and relocation bonuses, What would that money be used for? And I'm just wondering what other states are doing, because I know this is a national challenge, first responder recruitment.
I'm sorry, sir. What point are you on? I'm sorry.
On the Office of recruitment at DCGS, or recruitment in
okay.
general, if you could give us any more detail. I know that we've got a national challenge with recruitment of public safety officials, and I'm wondering, is that money all go to sign-on bonuses or relocation bonuses, or is there anything innovative around the country that's working or that we've done in Virginia that we want to put more funds behind?
Yeah, great question, sir. It's a multi-pronged approach to recruiting our professionals to the Commonwealth. That does include wellness, that does include signing bonuses, that does include social media advertising. They would like to produce a professional video that shows the advantages of moving to the Commonwealth for overall recruitment, as well as continuing to increase our footprint with allowing, in option 5, other state-certified law enforcement officers to move into the Commonwealth.
Okay, and one question or suggestion, which won't help us in the very short term, but perhaps in the longer term, are we doing anything with to get young people, high schoolers or college students, into like academies to expose them to law enforcement as a career? So besides getting people to move from other states, to try and focus them on that, so we'll have more people in the pipeline?
Yes, sir. There's some very advanced programs, not only with local municipalities that are recruiting not only at the high school level, but they have Explorer programs that bring high school students, community college students into the profession. There's also at VSP a dispatchers to trooper career path as well, so people can come in and start as a dispatcher and then move over to the trooper ranks. So we're trying to open our toolbox and make it as easy as possible to recruit and retain and bring these young individuals into the Virginia State Police and other local municipalities. Yes, sir.
Thank you.
Yes, sir. Okay. I'm going to let the director tackle the budget savings for the DOC and move directly into public safety. And I'd just like to run through these slides real quick. And this is what we're seeing here in the Commonwealth. So all these slides, all these things we're going to discuss are specific to the Commonwealth. The amount of cybersecurity attacks here in the Commonwealth continues to increase. Last year in 2023, we had approximately 90 million cyber attacks here in the Commonwealth. 90 million attacks, all from foreign adversaries. These foreign adversaries include Russia, China, Iran, and North Korea. These were some of the significant events we saw across the state. And what our response has been with VITA, with preparing with the Virginia State Police, along with working with our federal partners with this cybersecurity infrastructure, as well as with the FBI. There's currently new reporting that's been established by the SEC that mandates all private entities that experience a cyber attack have to report their cyber intrusion within 4 days to the FBI, which then is passed on to the Virginia State Police. So we've seen significant activity. When it comes to human trafficking, we've seen an uptick in the Commonwealth with human trafficking. The VSP is currently working 138 human trafficking cases, along with our federal partners at HSI and the FBI. These task forces are critical for the overall identification of these criminal elements. When it comes to the human trafficking number, specifically the Internet Crimes Against Children, which is a task force run by VSP along with Homeland Security, we've seen the amount of cyber tips increase this year to 6,300 tips. We have 106 reported arrests in that task force. We've been able to save and rescue and identify 66 young kids that were being trafficked. Our response is to be increased presence with our federal task force and to continue to increase legislative initiatives to assist the Virginia State Police and our federal partners with combating human trafficking. The Office of Attorney General, along with the nonprofits, continue to play a vital role in training, educating, and public awareness announcements. When we talk about illicit drugs in the Commonwealth, we continue to see an uptick in fatal poisonings. Approximately 76% of all fatal poisonings is incurred with fentanyl. Next slide you'll see is the amount of narcotics that not only the VSP and our federal partners continue to seize here in the Commonwealth. We've seen an uptick over the years in cocaine and methamphetamine, along with a decrease in heroin. This is due to the opioid epidemic, along with the fentanyl seizures that continue to plague the Commonwealth. These numbers will continue to rise with the Mexican cartels dominating overall distribution and production into the United States. If you look at the fentanyl seizures this year alone, we've increased from 104 kilos in 2022 to 135 kilograms of fentanyl here in the Commonwealth. That's roughly about 135 million tablets equivalent. You can see the fatal dose of fentanyl on the left, represented in the penny, and carfentanil on the right. That is a fatal amount. This is the new opioid we've started to see in the United States. We do not have any reported cases here in the Commonwealth, but this is the next line of opioid, 10 times stronger than fentanyl, that we'll soon be seeing here in the Commonwealth. This is also being manufactured and produced in Mexico, along with precursors that are coming in from China. With the with the homicide rate, the poisonings continue to increase. The amount of deaths in the Commonwealth will continue to rise. We've partnered with our state and local partners, along with the federal task force, to continue to investigate and bring these international cartel members to justice here in the Commonwealth. You can see with I-64 and 81 and 95 as the pipelines throughout the Commonwealth. They also are the flow for illegal narcotics and human trafficking throughout the Commonwealth.
Mr. Secretary, is there any connection with the illicit drugs that people overdose on, and with cartels who would bring illegal cannabis into Virginia? Are they the same providers, the same drug dealers importing cannabis that are importing the more dangerous drugs?
Yes, sir. In a couple slides, I get into just a brief overview of the cartels that are controlling the narcotics trades here in the Commonwealth. So predominantly Sinaloa, CJNG, and the Gulf Cartel are the three major cartels that are suppliers to the Commonwealth, and they have also established their command and control in the Commonwealth.
So if we were to tax cannabis and take it out of their hands, perhaps we could stop enriching them with that?
I think the taxation is a tricky comment, or tricky way to look at it. I would love to have
I mean, if it was regulated, I just don't like being sold as the back of someone's truck and you don't know what you're getting.
Yeah, I would love to have a conversation with you offline regarding that. Just the amount of increase that we're seeing in overall narcotics that's coming across is extremely disturbing. But to your point with the marijuana, I'd love to have a conversation with you offline.
We'll do that another day.
Yes, sir. Thank you. The increased gang activity in the Commonwealth. We currently have 648 homegrown and national gangs operating in the Commonwealth, which is pretty significant. You can see we have a color-coded chart. I'd be happy to share that with you, what's affiliated with what type of gang movements here. And then we get into gang
Mr. Chairman?
drugs. Yes, sir.
Senator Marston.
Thank you.
Oh, I'm sorry.
Back 20 years ago, one of the phenomenon going on in terms of gangs in incarcerated environments, Department of Corrections, Department of Juvenile Justice, we experienced the phenomenon, I think as I remember the name of it, was People Nation, where the gangs attempted to organize themselves around the idea that, look, we're all different gangs on the outside, but inside we're one group against, the department. Are we seeing that phenomenon still exist, or are the gangs operating separately within the Department of Corrections?
Yeah, I'll let the director and the chief deputy address that. I know that we are seeing significant gang activity within the prisons. We're also seeing significant narcotic activities within the prison. And I know that the director and the chief deputy would be happy to talk about that. And we could also talk about that offline with some of the active things that are going on to prevent that, sir. This slide reflects the influence and command and control of the three major cartels that are operating in the Commonwealth: Sinaloa, CJNG, and the Gulf Cartel. Sinaloa is associated with Chapo, that everybody seems to remember. His sons currently run that organization. CJNG is run by El Mencho, which is a Jalisco-based Guadalajara cartel. And the Gulf Cartel predominantly runs the Gulf when it comes to human trafficking. You can see they're prevalent in all parts of the state, and they control all narcotic movements that are coming in from Mexico into the Commonwealth. What we've seen is, which is very disturbing, is that now there are direct connections from the Commonwealth into Mexico. It used to be the Commonwealth distributors would talk to the source of supply in New York or talk to the source of supply in Texas, and then they would talk to a border town, and the border town would talk to leadership in Mexico. We now have cartel leadership operating in the Commonwealth that are talking directly to cartel leadership in Mexico. This is very disturbing. And then the gang response, we have numerous multi-jurisdictional task force, federal, state, and local partners working together. We participate in monthly training, awareness, and we're continuing using our violent crime reduction strategies to combat some of these transnational groups and organizations that are operating here in the Commonwealth. When it comes to Homeland Security, we're starting to see an increase of drone threats, unregulated flight path drones, not only in the Commonwealth, but into our correctional facilities, where they're dropping any type of contraband from weapons to cell phones to narcotics within our facilities. Our Homeland Security response in reference to those drones is to work with HSI and the FAA and the Virginia State Police to better understand, better regulate, and better monitor these type of intrusions. The Fusion Center plays a vital role in multi-coordination between agencies, provides systematic information, and shares in real-time intelligence with our partners. And lastly, this is from a case that DOC recently worked regarding some of the seizures that were going in. This is one event into one prison. And then officer wellness is near and dear to my heart after serving the United States for so long. It appears to me that our men and women that are on the front lines, that are first responders, are under more stress, and we're tasking them to do more things than they've ever done before. And it's critically important that we address the needs of law enforcement, whether it's the depression, the anxiety, the PTSD. We need to come up with creative ways to make sure their officer wellness, their well-being, is taken care of. I applaud the Virginia State Police for hiring their first wellness coordinator that includes therapy and a service canine. I've seen the service canine in action, unfortunately, too many times, but I've seen the joy that it brings victims. I see the comfort it brings victims, and I think that this is a program we can continue to be the leader on in the United States. And I'm open to any questions.
Thank you for your presentation, Secretary Cole. We're appreciative of your efforts and your entire team's efforts. Do members of the subcommittee have any additional questions? Senator McDougall.
Mr. Chairman, one of your questions spurred a question for me. It's long been my understanding that as we look at drug distribution, and now it's very organized, it's a paramilitary structure coming through the cartels that are initiated in China, and those paths are not just one drug, that these are distribution systems, much like a UPS or FedEx type of system, and they're bringing all drugs from cannabis to fentanyl and ostensibly probably this new one. Is that still a correct understanding of how that system of distribution works, or is it changed?
That's exactly how it works, sir. In the United States, and specifically the Commonwealth, is under siege from these cartels. They are not only trafficking narcotics, they're trafficking people, they're trafficking guns, they're trafficking money. They basically control that infrastructure, not only from Mexico across the open border, but into the United States and into our pipelines.
Mr. Chairman, one other question. When you have the further discussion with the chairman or this committee about cannabis, I'd also like to hear in the states that have legalized it and taxed it, like Colorado and California, if they've seen a reduction in the illicit sale of cannabis through these drug distribution networks, or if it's continued in the same manner as well. If you could include that in the presentation.
Yes, sir.
I'm going to just follow up on the question I asked you about the recruitment of young people. I was wondering specifically with DOC, the Department of Corrections, have we done anything to target young people for careers in corrections, and how is it working? Are there anything that we can take and consider amplifying if it works well?
Yeah, if I could punt that
Sure.
to the director, I will tell you that the director and the chief deputy have been very forward-leaning when it comes to recruitment. I think one of the biggest challenges is at DOC they really need a career path, and I think that's one of the avenues for lines of funding, to have that career path so they know where they're going to be as far as a salary and commitment 3 or 4 years out. But I think they've been very forward-leaning in trying to recruiting, but I'll leave that
Okay, we'll take that in the next presentation.
Yes,
then.
sir.
Okay, well, thank you. Senator Hashmi's got a question.
Thank you, Mr. Chair, and thank you for your presentation. I had the opportunity to attend the Virginia State Police presentation on all the good work they're doing. Certainly the wellness program that you highlighted is really, really impressive and very necessary. We also got to hear from the Virginia Fusion Center and some concerns around domestic terrorism and the recruitment and the growth of paramilitary militia groups here inside Virginia. I'm concerned because I was contacted by one of our community colleges. There were flyers that were posted all around campus seeking to recruit young folks into one of these operations, which is essentially a white supremacist, neo-Nazi kind of an operation. And I was just wondering if you might be able to speak to, are we seeing a growth of these kinds of groups and activities in Virginia, and how concerned should we be about such operations?
Yes, thank you for your question, and that is a concern. Not only the group that you mentioned, but the motorcycle gangs that are influential here. On a more operational level, I would love to have a conversation with the committee in a closed door to talk more in depth about that, because I think these are issues that are imperative, they're important. It's something that the Fusion Center is focused on with our federal partners. So I would love to have that conversation offline to continue to brief you, and I'm always available. Yes, ma'am.
Thank you again. Thank you again for the presentation and for your work.
Yes, sir. Thank you. Thank you, Mr. Chairman. Morning. Yes, ma'am.
Okay, we're going to next hear from Judge Dotson, Director of the Department of Corrections. Welcome.
Thank you very much, Mr. Chairman. If I can begin by at least trying to address a couple of the questions that were directed at the Secretary. first of all, we are not seeing, Senator Marsden, we're not seeing a lot of coordination in terms of gang activity within our facilities. When you said that, it sort of struck I hadn't heard anything about that, so we checked quickly with our security director because I had not been informed if they were. We're not seeing a lot of that. We are seeing plenty of gang activity, obviously, as I'm sure you're aware, but not coordinated, thankfully. With respect to recruitment, we have done some events with high schools, not many. We do have embraced the Virginia Community College system. Actually, in the last few months since I've been at the Department of Corrections, we're trying hard to really embrace the Virginia Community College system to help us in recruitment and in education training for our new officers. Our recruitment has actually it's gotten better month after month, and I think some of the work from General Assembly in terms of funding for new officers has helped in that without question. The Secretary mentioned, and in my presentation here in just one moment, I'll mention as well, the career progression. It's my opinion, it's the opinion of our team, that's really the next step to being able to maintain the sufficient workforce. We're churning through a lot of people. We're bringing a lot of people in, but we're not retaining as many of them as we need to. And retaining those officers that we've already trained that clearly have an interest in public safety and in working with us, we got to keep them on board. So just we'll run through the decisions that were made with respect to the prison closures, and again, I'm open to questions at any time during the presentation. First, obviously, is Lawrenceville. Lawrenceville has been operated by GEO Group, and the contract term will end on August 1st. Well, it ends July 31st, so we're gonna assume management of Lawrenceville as of August 1st. Currently, it's not quite capacity. There's a little over 1,200 beds currently filled there. We hope to bring it up to almost nearly full capacity in the coming years. We are beginning the process, as I'll discuss in a moment, of the hiring process and really getting things ready to take over. With Augusta Correctional Center and Sussex 2 State Prison, along with our Haynesville field unit and our Stafford CCAP, we do intend to close those effective the end of June 2024, at the end of the fiscal year. Begin with Sussex 2. Shortly after after the Governor Youngkin appointed me as the director of the Department of Corrections, we made the decision to what we call compress certain facilities, including Augusta and Sussex, because of staffing issues. We felt that staffing issues, as you know, are public safety issues. They're safety for our corrections officers, for our inmates when we're not properly staffed. So at Sussex 2 in particular, we sort of took all the inmates from Sussex 2 and the employees, moved them over to Sussex 1, which is another prison, same footprint there in Sussex. And the decision was made to just go ahead and shutter Sussex 2 for safety reasons. It's going to also, we've had some issues with the locality in terms of emergency management and water service. We take up a lot of the bandwidth in the locality there when it comes to emergency management. So it's to reduce that. It's going to generate some expenditure reductions, as you can see on the slide. We expect to capture a savings of $24.4 million in the fiscal year 2025, $27.8 million the following year. And we mentioned overtime there. That's a big piece of this. In recent years, the Department of Corrections has spent so much money in overtime, drafting people mostly from out west, or we don't have the staffing issues in the Southwest, as Senator Pillion will tell you. So sometimes we have volunteers, but sometimes we're having to draft individuals to come in, leave their family for a week, and we're having to pay overtime, we're having to pay travel costs, we're having to pay hotels. And so that also went into kind of the mix of why we thought it was a financially sound decision to close these prisons. As it says, there are no inmates currently at this facility because we did compress those. At Augusta,
Can I ask you a technical question
Sure.
about that?
Yes.
So if there are not any inmates on site right now in Sussex 2, why has the closure not become official till June 30th?
We're still working on, well, that's a good question. Actually, now that I think about it, we could,
I mean, wouldn't there be a cost savings? I don't know what one does to close a facility. If, I'm assuming there's some
some of that is.
wind down services or
Certainly there
something.
are, and there's maintenance that needs to be done at Sussex Ones before we're fully ready to, to
But
utilize that.
if there's no inmates, perhaps there could be a savings to close it sooner. I don't know.
Perhaps. Let me.
Okay.
Can I get back to you on that?
Sure.
And
that would be
Judge
welcome.
Jackson, and obviously you can fact check me, but my understanding from your finance team is that essentially the staff that were still there, and that obviously there are no inmates, they're going to be on temporary assignment until June 30th. So then all those WTA and severance type costs will start on July 1st, the way it's currently planned. That's my understanding from the finance team, but obviously if you
Thank
could
you.
fact check, that'd be great.
No, we will get back, but that is a piece of it. That the employees that we moved over temporarily to Sussex One, they were hired for Sussex Two, and so there are potentially some WTA costs. We have to offer them that just as in terms of transferring them over to Sussex One. Most of them we hope are going to just want to transfer over next door essentially, but we are required to offer that.
Mr. Chairman,
Senator Marsden.
having been through that with the closure and the redirection of the Culpeper Juvenile Correctional Center, it takes months of dealing with the employees and their situations and the anxiety created by the change in job assignments or the retirement decisions, and it changes the whole dynamics in a facility where all of a sudden, people are just not as invested, and it just creates all kinds of human dynamics that need to be very carefully dealt with as you're making these kinds of shifts, and because there's so many people involved, each with their own story, their own difficulties that this creates, but the potential here is enormous, and we thank you for taking the
Well, and it's
action.
I'm sorry, thank you, Senator. It's especially acute at Augusta, where we have around a little over 200 employees, and generally, when the department has closed facilities, they've done it in 30 or 60 days. We're actually fortunate to have a little bit of a longer timeline here, so it can help us place employees. But there's still those anxieties, and there's still also the idea of motivation. And if people are leaving Augusta, we're going to have to reduce the population of inmates there more quickly than we'd like. So certainly it is it's a high stress situation for a lot of folks there. I went down. We had teams go into each of the facilities. I went personally to Augusta because that's where we had the most employees on December 15th, and looked them in the eye and tried to explain what we're doing. We've been down there, had a town hall with Senator Obenshain and Delegate Runyon since, and we have HR teams on site weekly, and each individual employee at each of these facilities has a contact point within human resources that if you have questions, this is the person you call, and so we're trying to kind of hold everyone's hand. We hope to be able to place everyone. Obviously, we do have vacancies in the Department of Correction. We would love to keep every one of these employees, and so we're working to do that. Closing is going to capture a savings of $24.8 million in fiscal year 2025. We anticipate $31.1 million in fiscal year 26. Augusta is a lot more challenging than the rest of them in terms of placing people with the department. Now, obviously, the reason we have had difficulty staffing Augusta, and why we anticipate we would continue to have difficulty if we kept it open going forward, is because there are the economy in Augusta County is actually not that bad. There are other good options. So some people will choose to leave us. We're trying to be as think outside the box, essentially, as much as we can to try to place them, because I want to keep every single one of these employees. Because frankly, it needs to be said that these employees at Augusta have been working under difficult circumstances over the last few years. We've had to draft people in to come help them, but they have unfailingly worked above and beyond to keep that place running efficiently. It could have been a really a bad situation for the Commonwealth, and thanks to the dedicated employees and that leadership down there as well, it has not been. So Lawrenceville, we do intend to assume management of Lawrenceville on August the 1st. GEO Group has been very helpful and I presume was going to continue to be helpful with that transition. We hope within maybe today, sometime this week certainly, we're going to have some guidance for the employees at Lawrenceville about interviews. We're going to go on site, hopefully, and NGO has said they would assist us with that, go on site to interview them at the prison if we can, to try to do what we can to make sure that we can retain as many of those employees as possible. Now, some of those employees are not going to have been trained up to the standards that we require, so we're going to have to work through that training piece with the Department of Criminal Justice Services and with those employees. Again, the fact that we have until August 1st here hopefully is going to help us with that so that we can get fully staffed by that time.
Can I ask, of the current employees, is it fair to say that if they want to keep their position but be employed by the Commonwealth of Virginia with state benefits and presumably at a higher salary than they were earning with GEO, that they're all going to have that opportunity if they go through the training?
Well, if they qualify, there will be some people there that under our standards we aren't able to hire. But I would, and we're working with GEO now. They're supposed to, the leadership there is getting us the employees and the ones that we think do it. If there's not some reason, like they've been terminated from the Department of Corrections previously, if there's not some reason like that they can't be hired, we would like to retain.
Okay. So okay. Thank you.
Sure. We do think that. We have a plan in place. We don't think we know. We have a plan in place. The department's done this many times to get leadership in place and then start the process of not just hiring those employees, but we have to develop our policies and procedures there for that particular place. Post orders, emergency plans, and again, getting everyone DCJS certified before August 1st is the goal. And doing other hiring events. And as a matter of fact, there are actually, we just this week I found there's a handful, not many, but a handful of Augusta employees that we think are going to want to go to Lawrenceville if possible. So we're going to do that placement. So the funding request and what was included in the governor's, I guess in the caboose bill, was $5.3 million for this startup hiring and training. We have to have a warden there. We have to have a full leadership staff there to begin the hiring and training, and then $24.5 million for the final contractual payments to GEO, and then what we might need in startup equipment, supplies, and operating costs. And we just had a conversation a moment ago about potentially there's some equipment there, drone detection equipment, body scanners that GEO has purchased that we might be able to repurpose. We're going to have those discussions in the coming days, and then $18.4 million fiscal year 26 for operating costs. So just briefly, because these are smaller units, but we are closing the Haynesville Unit 17. Approximately 37 impacted employees. This was another one that previously the staff had been temporarily assigned over to Haynesville Correctional Center nearby to support the staffing levels and the compression that we did early on. Again, trying to maintain sufficient staffing in as many places as we can. We hope to be able to replace all that are willing in the Haynesville Correctional Center, and you can see on the slide what we expect to capture in terms of savings in the next 2 fiscal years.
I'm not familiar with what Unit 17 is. Is that a sub? I mean, you say it's 37 employees. What exactly is that compared to the actual correctional facility?
How many do we have at? Yeah, but how many employees do we have at the correctional center? Do you know that?
Correctional Center is going to be between 250, about 300.
Okay, so it's like an auxiliary to the
Essentially,
staffing.
yes.
Okay.
Yes. And this is my, for those of you that haven't met him, this is my Chief of Corrections Operations, Dave Robinson, who's my go-to guy. He's been with the department for many, many years. Stafford CCAP, this is the one that caused me the most heartache to have to close. Our Community Corrections Alternative Program, obviously, is an alternative to prison for a lot of people. We provide job skills. We actually work out in the community. We help them with jobs out in the community. Substance abuse treatment, mental health treatment, really kind of holding hands for people, a little extra help as they re-enter into society. Because of the changes in the probation violation guidelines a couple years ago, judges don't have the discretion to send people to our CCAPs. And so we're not able to fill our beds. And so We have 4 other men's CCAP programs and a women's CCAP, women's CCAP. I think they're just about the best thing we do in a lot of ways. The data shows great success rates from graduates of our CCAP programs. I spent 14 years on the bench and didn't realize until I got inside the Department of Corrections and saw the data how well they actually work. So my hope is to go to the next statewide judges conference and maybe talk to some of my former colleagues and explain to them, hey, there are alternatives to prison here that actually work, that have great outcomes for those that go through them. And matter of fact, the first time I went last year, I was with the parole board, obviously. First time I went to visit Chesterfield's women's CCAP, and I was walking through and just seeing it, and a woman walked up to me and says, "You were my sentencing judge." And I thought, oh boy, when you hear that, you don't always want to hear that. But she said, I want you to know I'm getting out next month. I've got a job lined up for me. My family's finally back in my life. I'm clean. And she was so excited about the future. And so it was, it made me wish I had sentenced more people to CCAP. But we do have beds for everyone that has currently been ordered to a CCAP around the state. We have beds available. So that's why maybe at some point we could even repurpose the Haynesville unit for a CCAP if we needed the beds at some point. But it is an effective program.
Senator Pillion.
No, we're closing that particular program, but everyone that's currently in that CCAP at Stafford will be placed in other CCAP programs. We have them around the state. I think one in your district, the Appalachian CCAP. But yeah, everyone that we anticipate to have enough beds for everyone, unless there's some huge wave of people getting sentenced to that program.
Do we know how many sites there are with the CCAP around the state, or how many beds total in the state there are for this alternative program?
Do you know how many beds we have for CCAP right now? I'm not sure the exact number. I can get it for you, but
We can get it, but it's running, after taking that one offline, it's going to be somewhere between 500 to 600 beds.
Okay, thank you.
and we're probably running maybe at 70% capacity on those, somewhere in that neighborhood. So the idea behind Haynesville is it's there on the site with Haynesville Correctional. In the back of my mind, my hope is that someday, if we have to have more beds, that's a place we can have more beds for our CCAPs if we need them.
Thank you.
So I've talked about a lot of this. We're holding their hands at Augusta as much, well, everywhere, but certainly at Augusta because that's our biggest employer of these four. The Department of Human Resource Management has granted waivers for yellow cards so that if they can't stay with us, they can get priority for other state jobs. We have sent out a memo to other facilities within that the area, essentially with a 120-mile radius, telling people if you're ready to retire and you want to retire now so we can give your spot to someone else that's coming from Augusta, we're trying to think outside the box to place as many as we can.
In your earlier slide on Augusta, you mentioned that only 126 employees reside in the Augusta area of Augusta, Waynesboro, Stanton, and that 96 lived outside the area. Those 96 are outside the area. They're largely in areas that they can perhaps get to another facility in Virginia easily and be retained.
I would say the vast majority. Some are from as far away as one lives in West Virginia, actually, and is driving. That one was a little more difficult, but yes, the vast majority of those are a little bit easier placement, I would say.
So the 126 reside in that area. They would have to, I don't know how far the drive is to the nearest facility with a vacancy. Some of them would have to relocate if they want to stay working in a correction setting.
Potentially, yes, but we're also trying to get creative about offering 7 days on, 7 days off, shifts, so that they can go work and that's actually very attractive to a lot of people. Go work for 7 days, then you get 7 days off, so they'll drive and have to be away from their family maybe for a week. We've had a number of people actually ask us for that, if we could do that. So we're trying to make it as easy as possible in terms of even providing transportation if we can to some folks that are going to other. We're trying to do everything we can to make sure we place everyone. I don't want to eliminate any ideas at this point.
Thank you.
And the last thing I'll mention is that Middle River Regional Jail They have just like all correctional facilities, they need staff, and that's in the area there. And I've just talked yesterday, and actually some of my deputies talked separately with both the director of the Shenandoah Training Center and with Jackson Miller, the director of the Department of Criminal Justice Services. The DCJS has already told us, here are the extra training that they're going to need to go work at a regional jail. The training is actually a little different what we do as opposed to a regional jail. They have more of a law enforcement focus, so they have to be trained. Our employees would have to be trained up on that. So we've determined the price so that we can get them trained. However many want to go work at Middle River Regional Jail, get them trained up basically on our dime while they're still employed by us. We're going to pay their salary and let them go to the academy. And then as soon as they're trained at the end of when we close Augusta, they can immediately transition into the Middle River Regional Jail.
Thank you.
I think I've already gone through everything, all of this with Lawrenceville and Sussex as well, I believe. I would note that we are working very closely with the Department of Human Resources Management, Virginia Works, and with the Department of Criminal Justice Service on all these. I'm really optimistic that we're going to be able to place almost everyone. I hope everyone that wants to stay with us has that opportunity. Some of the other decision packages that were included in the governor's introduced, the career progression, I already mentioned. I really think this is key to us being able to maintain staffing standards, is to have an opportunity, especially for those correctional officers that aren't necessarily seeking to become, to move into leadership. They want to be a correctional officer, and they want to be able to have a career as that. We want to make that available to them. And frankly, coming from where I come from, which is Wise County, a lot of my old high school buddies that probably would have been in the coal mines, frankly, that's their career now, and they've made a very good career out of it. Some of my best friends, one of my best friends just retired after a great career with the Department of Corrections. So we want to make sure that we're able to make that available. There's funding for additional full body scanners and then upgrades to the current equipment that we have, because we can talk all day about the challenges we have with contraband getting in. There's any number of ways they come in. They come in through drones. They come in through visitors. They come in through our employees. Okay, we're trying to attack it at every point. The funding for 218 vacant security positions, when the General Assembly authorized a pay increase for our security positions, essentially the pay was increased for the positions we already had filled. We're at the point now where if we hire any more people, we actually don't have the funding for the increased pay that was given to everyone else. So it's having to come elsewhere. So we're hoping to be able to make up some of that difference here. And then with our food, we are now required to give religious meals for inmates that request them. So there's an increased cost to food that has not been appropriated. With utilities, our utilities, we were funded at the level we were funded at in 1992 on our utilities. So we've been kind of absorbing the extra cost in utilities for our facilities. So there's a little bit of extra funding in the governor's introduced, just kind of to make up some of that difference. There's a $1 million budget reduction on the assumption that we're going to be able to recognize some savings. $500,000 to support medical transport service. I mentioned that earlier with Sussex. There's a little frustration with the locality on how much we're using the medical transport services, because we have to use them. We have to care for those that are in our care, and so a little extra funding to support them. And then a little reduction in our DMV Connect program, the program we have with the Department of Motor Vehicles to help get people licenses. We think we can still manage that program, but a reduction. I believe that's the last one. If there's
Thank you.
I try to run through as quickly as I can to be respectful of your time.
Informative presentation. We appreciate your work and appreciate your staff's work. It's nice to see Mr. Robinson here, who I met so many years ago when we went out to Red Onion, and I've followed his career as well. I wanted to ask you whether the inmates moved as a result of the closures are all able to be accommodated at other facilities. In terms of your population projections, does the system have sufficient capacity to still provide appropriate security level and services to all the state responsible inmates, or are we going to have some people in the regional jails? Or How will that work?
Thank you. It's a good question that maybe I should have addressed. Yes, this anticipates all the, and I'm on the prisoner projection forecasting committee as well, have been since I arrived here last January. We anticipate that we're going to have sufficient beds at sufficient security levels for everyone in, at least for the next few years. If things change, I don't know, but our numbers are down. The people that are in our care, those numbers are down, so we have faith that we're going to have the beds available. Yes.
Okay, and also the closures. One other question on the facilities. We had put money in the budget a few years ago to air condition several more facilities because there are some that don't have air conditioning. With climate change, I imagine some of them can get quite warm in the summer. How does it track with the ones that are closing versus are open? Are we still going to have a number of facilities without any air conditioning?
I'm going to ask Mr. Robinson to address it. How many do we have?
The three that closed, with the exception of Sussex, did not have air conditioning. And as you're aware, there is a plan to continue to put air conditioning in other facilities. So there'll be some that still that's there. But there is a plan by Mr. Newton.
Okay, so there's funding for some more AC units in the coming years.
I'm not sure. I know that he has a plan. To do
Okay.
that. We have to check to see.
I'm glad to see that. Oh, thank you. And then the long-term plan for the closed facilities, I know there was at least one that you were going to look at upgrading and reopening when needed, but what are we doing in terms of those facilities? Those are, I guess, significant assets.
Yes.
And will it just be shuttered indefinitely, or do we think we'll have to reopen them eventually?
Well, with the Haynesville Field Unit and Sussex too, they're basically connected on the physical plant there. It's a little difficult to separate those and sell them. So those will be shuttered, with the idea that if we need the beds at some point, it would require, we're going to do keep doing routine maintenance of those, but otherwise nothing. With Augusta and with Stafford, it's really the Department of General Services. At this point, it's out of our hands. But I don't anticipate ever opening those facilities again. So they are available to for whatever purpose.
Okay, and I guess my final question, unless there are members of the panel with questions, is about the staffing formula. With the significant decline in inmate population, do we need to review the staffing formula overall in light of that population decline?
Well, I think the current staffing standards are probably adequate, but it's never a bad idea, I don't think, to just kind of see where we are and review those, because the landscape has changed from, even 5 years ago, certainly with the reductions and with our reductions in staff as well. Although our staffing, again, it's getting better month to month.
Okay. Well, thanks again for being here, and I'm going to turn over to Senator Marsden for a final question.
Well, thank you very much, Mr. Chairman. Just to recap, last year I had a bill that I sponsored that created the Ombudsman's Office for the Department of Corrections, independent oversight of, to look at systemic kinds of issues within the department and perhaps some, serious occurrences that take place. And I had a great conversation with Director Dotson and Deputy Dave Robinson around the notion that while the bill was killed in House Appropriations, it came through pretty much unanimously, but the office was created in the budget with $250,000 to set up the ombudsman, and we have the bill coming through this year to kind of got it backwards, but hopefully we'll get the bill through this year. But we had a conversation. There are somewhere in the high 20s the number of investigators that exist within the Department of Corrections, and I was hoping that with some of these closures that we could transfer, if you will, a number of those investigators to the IG office and not have to create new money, and had a great conversation with the director and Dave Robinson about the potential for doing that so that we don't have to appropriate new money, and was just wondering, and here's my question, is how ultimately I realize that you have to establish what you're going to investigate and what the Inspector General's office is going to have to do, and I assume a lot of that will take place with the secretary to, to get that all established. But have you figured out at this point in time how many positions might be available, or are you still having those discussions?
I'll say this. Some of it's going to depend on what the Office of the Ombudsman actually looks like once we get through the process here in the session. What I began, it's probably a week to 10 days ago, is a deep dive into our Special Investigations Unit, okay, to find out exactly what they're doing, how much they're doing, what the staffing levels are needed, exactly. When I get the answer to that, which I hope is going to be in the coming days or weeks, one of my deputy directors is in charge, Deputy Director of Administration, Joe Walter, in charge of doing that deep dive and reporting back to me. I hope to have a better idea of whether each of our investigators is fully employed, whether there's enough work, what exactly they're doing, and how it can be drawn up. So I think the answer to your question I should have hopefully in the coming weeks.
Great. Thank you so much.
Thank you.
Thanks again for the presentation, for being here, and for your work. And please convey to staff DOC that we appreciate their work as well.
Thank you very much. I appreciate that. I will.
I believe next on our agenda we have a presentation from Katie, our staff, or Katie Robertson, on the proposed budget for Public Safety and Veterans Affairs. And we'll turn our attention to your presentation.
That's right. Thank you, Mr. Chairman. I'm going to go quickly because we only have 10 or 15 minutes, and I think I'm just going to start on slide 4 since we just heard a lot from the Department of Corrections. So slide 4 starts with all the other agencies. First, the Department of Criminal Justice Services. We heard from Secretary Cole on the $18 million for law enforcement recruitment and wellness. The next item there is victim, witness, and sexual and domestic violence agencies. So you all may remember there's been a decline in federal funding in recent years. And so this is just continuing to backfill that program to catch it up with the expected decline. One thing I'll note, and you might hear from those agencies, they did receive a 10% reduction from 23 to 24. So what this budget does is keep them at their 2024 level, so it doesn't backfill that 10% reduction, essentially. The next item, and again, feel free to interrupt me anytime with questions.
Senator McDougall.
Did you say it does not?
Correct. It keeps them at their fiscal year 2024 level, so which is 10% lower than their fiscal year 2023 level.
Mr. Chairman, do we know what that 10% dollar amount is?
Mr. Chair, Senator McDougall, I can get that for you. Not off the top of my head, but I'll get that. So the next item is $2 million to increase grants to combat hate crimes. This is an existing grant program. Currently, it's at $1.5 million. This takes it to $3.5 million just in the first year. I'll also note here there's a language change proposed in the introduced budget. So currently, the grants go only to localities that partner with nonprofits. This would allow the money to go directly to those nonprofits and bypass the localities. So that's just a language change that we'll be considering. Skipping to the last line under DCJS, you can see there's the credentialing management system. That's a system change they've been asking for a few years. And then this last item, remove funding for vacant position. That's the position for the body-worn camera grant program. That was a one-time grant program. Actually, a lot of the money ended up not being able to get out the door because the localities wouldn't provide a match. And so they've returned the rest of that grant money that was provided in 2020 to the general fund. And this removes the position that is no longer filled because they were managing that. Moving to Virginia State Police. So this first item, the sworn officer pay step increase, you'll remember in 2022, we provided a significant amount of funding for the Virginia State Police to establish a pay scale. And this essentially moves everyone 1.4% up on the pay scale. So it just moves you up for your additional year of service. This next item, replace 3 airplanes. Oh, I'm so sorry. Thank you. Thank you so much. So this next item, replace 3 airplanes. These have been damaged. Essentially, they hold these infrared cameras that are used for search and rescue, so they need to upgrade them so they can re-put on the cameras and fully use the planes for the mission. Secretary Cole talked about some of these positions, the Fusion Center analyst. One of them is dedicated to campus safety. They're already doing some of these efforts with higher institutions of higher education, but I think the goal is to coordinate, provide additional coordination. So this next item, med flight personnel for Chesterfield County. Essentially, there's two regions that have med flight, and you all may be aware, but one is based in Abingdon, one is based in Chesterfield. Those are the areas where basically the state is paying for people to have free medevac services to the hospital. Historically, the state, according to the state police, they're pretty sure that we have not provided state funding for the Abingdon region, but we have for Chesterfield. And so what's happening here is that historically, the state provided some funding for Chesterfield, and I should say, sorry, the state runs all of the operations, but in terms of the paramedics and the flight personnel, that's what's been handled by the localities and hospitals. What's happening here is basically VCU until 2023 was chipping in for some of those flight nurses and paramedics, and they made a business decision a few years ago to withdraw that funding. So this would make Chesterfield County whole for those positions that the county is now providing.
So can you help us with the rationale? I can understand in Abington, you might be, you're in a rural area, it takes longer to get to the hospital, so you might have to medevac more people. But in Chesterfield, what's the reason? I mean, what are they doing? They're finding people who are not near a hospital and evacuating them to a hospital in an urgent situation?
Mr. Chair, that's a good question. I'm not sure how they choose the two localities, and I can get more history. I know that the medevac only operates in a certain radius. I think it's 50 or 100 miles. Let me get more information on the background of why we kind of chose a more urban area to place it, since I think that's the question. I can get back to you.
Yeah, because I could imagine that Abington would have a bigger need because it can take longer to get to a hospital and so forth. But I'm curious how the Chesterfield compares. Senator Pillion.
Kate, you're saying that we're reimbursing Chesterfield County, but we're not reimbursing Abingdon?
That's my understanding.
Just because VCU chose not to participate?
Mr. Chair, Senator Pillion, that's my understanding.
But is Abington incurring costs, or is it paid for by the local medical community, or?
Mr. Chair, I believe so. Abingdon is funding some as a locality, and then Ballot Health is chipping in some out of Abingdon.
We'll learn more about it and talk about it.
Mr. Chairman, just as we're going through these questions, I think the Chairman had a good point about the geographic nature, because I would think that the Northern Neck Middle Peninsula has more of a geographic challenge in getting people to a hospital than maybe Chesterfield does. So want to know what's the region, because certainly we've heard of people in the Northern Neck getting stuck with a $30,000 to $40,000 medevac bill because they did not have other options,
Mr. Chair,
which is more than many of them make in a year.
Okay, Senator Hashmi.
These are really important questions. There may be a reason for Chesterfield County in that there is a trauma center at Chippenham Hospital, and so that might be the reason that
they're
there's.
bringing the people to the trauma center where there's let's find out if we can do it at a future meeting. Just a little bit of clarity on that would be helpful.
Yes, certainly. So moving to slide 5. This first item is the Department of Emergency Management warehouse. Currently, they're essentially covering this with their existing budget. This is just for the lease. It is as it sounds. It basically holds water, sheltering supplies, medicine, PPE to provide to localities in the event of a disaster.
Senator McDougal.
Mr. Chairman, it's my understanding that a lot of the materials in that warehouse were gathered during the pandemic and were ones that would still be usable if we keep them in a place where it's somewhat climate controlled?
Mr. Chair, Senator McDougal, that is my understanding. I am getting some follow-up information from them on just kind of expiration dates for KN95s and things like that, but that's correct. Basically, if you look at their inventory, a lot of it is things that we did receive during the pandemic that could be reused for a future, not just a pandemic, but other public health crisis. And then the rest is less public health related and more typical sheltering supplies and things like that.
Mr. Chairman, could I ask one other question as we're looking into that? I know we have some National Guard facilities around the state that might make it more accessible to different parts of the Commonwealth when there is an event. Could we find out if that's a possibility as we're looking at if we're having to move this from storage now, I guess it was right down the road here, in Richmond to other places? Is it better for it to be closer to people than just in Central Virginia?
Mr. Chair, so McDougal, yes, I'll look into if they've explored other regional options, including the National Guard armories.
It's an excellent suggestion. Thank you.
The next item, Department of Forensic Science. This is it's mostly for forensic biologists. They've seen an increase in DNA cases. There's some other items there. State Fire Marshal operating budget. Essentially, they're handling an increased number of inspections, but they've seen a decline in the fee revenue that they're collecting. So this is to help them address that workload. Commonwealth Attorney Services Council software. This is a small item, but it's just for, it's like Box. It's a file sharing software. These next two, Cannabis Control Authority operating budget and Department of Juvenile Justice operating budget, this is kind of similar to what you heard Judge Dotson talk about. There's 3 agencies in public safety where the administration is proposed they call it operational efficiencies. So it's $1 million at Department of Corrections, $750,000 at Department of Juvenile Justice, and $1 million at Cannabis Control Authority. My understanding is that they're going to direct agencies for that not to be taken out of personnel services, but just to essentially identify these cuts. But they're not identified in terms of where they would be coming from. The agency would have to figure that out.
And we're on slide 5 now?
Yes, slide 5.
Okay.
Sorry, I don't know why the advancing isn't working. Thank you. And then final item, this is a completed study, so this is taking the funding away for a study that is no longer needed. Finally, moving to slide 6. So the largest item in Veterans and Defense Affairs is $30.5 million general fund for the care centers. This is essentially, we have 2 existing care centers in Virginia, and this is for the 2 new ones, and this is to fund their operations until they're have additional patient revenue and they're closer to their full capacity. The next item, Veterans Virtual Service Center and Self-Service Portal. The Virtual Self-Service Center is essentially, it will be an AI call line. So when you come in and, the kind of thing where press 1 for this, press 2 for this so that they can better handle the backlog in cases and only have people handling personalized responses. And the Self-Service Portal is as it sounds. You can check on the status of your case with the Department of Veterans Services. I think the only other 2 I'll highlight here, since we're running a little short on time, is the Military Women's Memorial. So this is a current memorial. It's located in Arlington Cemetery, but it's managed by a foundation, and they've been looking to expand and create an education center. So the proposal is for this $500,000 to go to Arlington County to help the foundation pay for this new education center as part of the Women's Military Memorial.
Tourist attraction and to salute women veterans?
Yes, that's the proposal.
Senator McDougal.
It's not operating expenses, it's the establishment of the...
Correct. It would basically establish an education center attached to the current memorial, and I think it also adds like an interactive display and things like that. So it's really the educational display piece and not operating, just those one-time creation of that. And then finally, the last one I'll highlight is the Partnership for Petersburg office. So what's going on here is part of the governor's partnership for Petersburg is they created the Virginia Community Resource Center in Petersburg. And it houses mostly state agencies, but also some nonprofit and other service organizations. The idea is a one-stop shop for where you can go. Department of Veterans Services was essentially down the block and is moving into this collective office space and has been charged as the kind of the leader for the operation of this combined community resource center. And so this is for increased rent and additional personnel for that new combined office. Mr. Chairman, I think that completes my presentation. I'm happy to take any questions.
Are there questions for Katie on this presentation? Thank you. This was informative, and thanks for the walkthrough and
Thank
preparation. Okay, so with that, that completes our agenda for this morning. So with that, the committee will rise.
The Senate of Virginia, Richmond, Virginia.